If you're considering shockwave therapy for pain, stiffness, or chronic injury, one of the biggest questions you probably have is, how many sessions will I need and how quickly will I feel better? Hello, my name is Dr. Beth Templin and I am the CEO and founder of HouseFit. This is an excellent question because shockwave therapy is unique. Unlike treatments that simply mask the symptoms, shockwave works deep within the tissue to stimulate true healing. That means the results build gradually but powerfully and often continue improving even after your treatment plan is complete. As one of St. Louis's leading experts in regenerative therapy for aging adults, I want to walk you through what a typical shockwave treatment plan looks like, what results to expect, and why the healing process works the way it does. Understanding these timelines can help you feel more confident, hopeful, and excited about your path forward. So what makes shockwave therapy different from other treatments? Well, before we talk about the number of sessions, it's really important to understand why shockwave works, because the answer helps you see why the treatment timeline is structured the way it is. Shockwave therapy uses high energy sound waves to stimulate increased blood flow, reduced inflammation, collagen production, improved tissue quality, breakdown of scar tissue or calcifications, cellular regeneration. So unlike medications or injections that temporarily numb or mask the pain, shockwave encourages your body to repair the root cause of the issue. And because it addresses healing at a cellular level, the improvements continue long after the session is over. This is also why shockwave is a top choice for people whose pain has lasted months or years. It helps reset patterns of dysfunction that the body simply hasn't been able to fix on its own. So, how many sessions do you actually need? For most conditions, the recommendation is 6 For most conditions, the recommended treatment plan is 6 shockwave sessions, scheduled at once per week. This schedule has been studied extensively and is backed by strong clinical evidence. Here's why. The body needs time to respond to each dose of shockwave energy. Healing occurs in layers and stages. Tissue repair increases over days, not minutes. So weekly treatments ensure consistent progress without overwhelming the tissue. Some clients may require fewer sessions if the problem is mild or recent. Others may require more, especially for severe degeneration, long-term arthritis, or deeply chronic tendon issues. So what happens during each shockwave session? Well, understanding the process helps to clarify why you'll need multiple visits. So in session 1, we think of it as pain mapping and activation. Your first session identifies the dysfunctional tissue and gently stimulates healing. Many people feel improvement right after the visit, lighter, looser, more mobile. In sessions 2 through 3, we're going to intensify the repairing. Your body begins to adapt and we increase the energy level to stimulate deeper collagen production and tissue regeneration. This is where many clients notice meaningful change. In sessions 4 through 6, we're going to start to remodel and strengthen the tissue. These sessions reinforce the new tissue, improving fiber alignment and supporting long-term healing. Pain decreases, mobility improves, and movement becomes smoother and easier. So when should you expect to feel the results? This is where things get exciting because most people notice progress much sooner than they expect. Here's a general timeline. So immediate improvement is often experienced during or right after the first session. Many St. Louis clients report less stiffness, better range of motion, reduced pain, easier walking or lifting, more comfort during daily tasks, and results vary, but early improvements are extremely common. Second, you'll see meaningful changes after 2 to 3 sessions. So by the second or third visit, most people feel noticeable improvement. This is often where they say things like, I haven't felt this good in months, or my pain is finally going down, or I can move in ways that I couldn't move before. These changes happen because your tissue is beginning to regenerate. Blood flow improves, inflammation decreases, and collagen starts to rebuild. Continued progress is going to be expected for 8 to 12 weeks after your final session. And this is one of the most powerful aspects of shockwave therapy. Your healing continues long after the treatment session ends. So as collagen fibers form, strengthen, and reorganize, your tissue becomes stronger, more flexible, more resilient, and less painful. This delayed but ongoing improvement is something medications and injections simply cannot accomplish. So why do results vary from person to person? Well, shockwave therapy is incredibly effective, but healing depends on several factors. First, it depends on the severity and chronicity, or how long you've been experiencing your pain issue. So fresh cases of tendonitis may heal faster than a 10-year history of plantar fasciitis. But even highly chronic cases often respond beautifully. Second, age and tissue quality. Older adults are excellent candidates for shockwave because it stimulates processes that naturally slow down with age, but deeper degeneration may take slightly longer. Third, activity level and lifestyle. So movement enhances the healing effect. Too much activity immediately after a treatment may slow it, and too little activity can delay progress as well. So we will guide you on the right activity levels every step of the way. Fourth, it depends on if you do shockwave alone or if you combine it with EMTT and physical therapy. This is where we think the magic happens. When shockwave is paired with EMTT, it energizes the cells and reduces inflammation. When paired with physical therapy, it restores strength, mobility, and function, and your healing accelerates. We often see our best outcomes when treatments are combined strategically. So what conditions might need more than 6 sessions? Well, 6 is the standard, and certain conditions benefit from a slightly longer plan. These could include things like severe plantar fasciitis, long-standing Achilles tendonitis, chronic patellar tendon pain, shoulder calcifications, bone-on-bone arthritis, hip gluteal tendinopathies, complex hand or wrist arthritis. In these cases, 6 to 9 sessions may be more appropriate, but always it's determined based on your individual response. So why getting the right number of sessions matters? Well, we want to think of shockwave like watering a garden. One watering helps, but consistent, repeated watering produces growth. Healing works the same way. Your tissue needs repeated stimulation to break down old scar tissue, to build new collagen, to restore normal function, to restore healthy movement, and stopping too early can interrupt that process. A full treatment plan ensures long-term success and fewer future setbacks. So what does a personalized shockwave plan look like at HouseFit? Well, first you come in for a consultation, and we'll evaluate what tissue is damaged, how severe the degeneration is, your level of inflammation, your mobility and strength, how long you've been in pain, and what your goals are. Is it walking, lifting, stairs, recreation? From there, we design a customized plan that may include shockwave therapy, EMTT, strengthening exercises, mobility work, hands-on physical therapy. This integrated approach is why so many clients achieve better, faster, and more lasting results. So what does success look like for most clients? Well, after completing their shockwave series, clients commonly report major pain reduction, improved mobility, greater strength, better endurance, returning to activities they once avoided, reducing reliance on medications, and avoiding injections or surgery. Most importantly, they get their life back. They walk without hesitation. They climb their stairs with confidence. They garden, travel, lift, exercise, and play without fear. So how many sessions will you need? The only way to answer that confidently is with a personalized assessment. But here's the general rule of thumb. Mild to moderate cases, 6 sessions. Severe or long-standing cases, 6 to 9 sessions. And this would be for things like advanced arthritis or tendon degeneration. And we do often pair this with EMTT to get the best results. Regardless of where you fall on that spectrum, we build a plan that supports meaningful, lasting healing. So ready to get started healing with Shockwave Therapy? Well, if you're tired of living with pain, tired of feeling limited, or tired of hearing that nothing more can be done, Shockwave Therapy might be the breakthrough you've been waiting for. At HouseFit, we offer free consultations, customized treatment plans, advanced regenerative therapy options, and most importantly, a supportive team that understands aging bodies. So whether you need 3 sessions, 6 sessions, or more, we're committed to helping you move with confidence, strength, and ease again. Your healing journey starts with one simple step, and you don't have to take it alone.